నమస్తే, వెల్కమ్ టు ఆయుష్మాన్భవ. పిల్లల్లో జీర్ణ సమస్య ఎందుకు వస్తుంది? పిల్లల్లో జీర్ణ సమస్యకి తీసుకోవాల్సిన జాగ్రత్తలేంటి? పిల్లల్లో జీర్ణ సమస్య రావడానికి ప్రధానమైన కారణాలేంటి? పిల్లల్లో జీర్ణ సమస్యలకి చికిత్సా విధానాలపై వివరించేందుకు మనతో పాటు స్టూడియో ఉన్నారు అంకురా హాస్పిటల్స్ కన్సల్టెంట్ పీడియాట్రిక్ గ్యాస్ట్రోఎంట్రాలజిస్ట్ అండ్ హెమటాలజిస్ట్, అలాగే ఏపీ తెలంగాణలో ప్రముఖ డాక్టర్ అయినటువంటి పారిజాత్రామ్ త్రిపాఠి. వారితో మాట్లాడి మరిన్ని సలహాలు సూచనలు తెలుసుకుందాం. నమస్తే డాక్టర్. We keep on hearing that like stomach pain and etc. like stomach related issues are increasing in the children these days. What are the main reasons?
So I'll tell two main reasons. I will say one thing, of course, with the improving concern of the parents, with improved awareness. Now people are able to detect things early. They come to the doctors early. That's a separate thing. But definitely stomach related issues are rising in the children. The most important reason, as we all know, is diet. Okay, so what it used to happen like years long, or when we were the kids, we had no opportunity to eat so much of outside food. It was like a event when we are getting outside food. But with the advent of all the online apps and all, everyday kids are eating junk. Eating junk has become a kind of lifestyle for the kids. So that gives them a lot of processed food, very high sugar, very high salt, very high oily foods. And the quality is also we don't know. So that is leading to increase in the GI problems. Now the second reason is a lot of, I will say, sedentary lifestyle. They are watching TV into the screen all the time. So their physical activity is very poor. So when they are not doing physical activity and eating a lot of junk food and all, that is again affecting their gut negatively. Now the third thing, what I always say, the addiction to screen, other than not doing the physical activity, they affect their brain, the ability of brain to process the problem. So with the small problem, children can behave like they are very sick or something, what we call functional disorders. Even they are also rising in children. So even functional, where we are not serious, but child is perceiving that problem is too much, and the serious stomach issues, both are rising in the modern times.
Okay, and the parents should get to know or differentiate the difference between this normal stomach pain or the gastro related pain or
So I will say this is one of the most difficult thing even for a doctor also. Like if a child comes to me with stomach pain, is it real or not real? How do you know? There is no machine that you put inside the tummy and the pain is real. Even our perception of any symptom varies depending upon our stress level or our happiness or anything. If I am happy, I may not feel anything is bad. If I am sad, any small thing I may feel too much. So, but the important thing is to understand the danger signs. If there are few danger signs are there, then parents should become alert that no, this is not simple abdomen pain and I need to go to the doctor. So these are the things, like if stomach pain is very severe, child is crying, he is not able to eat food, he has changed his daily activity. Like what we say, it is affecting child's daily life negatively. He used to eat his happy favorite food, but now he is not eating that. He used to be very active otherwise, but when pain happens, he is going in the corner and sitting with his tummy. In the middle of the night, he is getting up and crying with the pain. Or this pain is associated with vomiting, loose motions, blood in the motions, or even if mild pain which is persisting for a very long time. These are the things which parents have to look for. If these things are there, they have to meet the doctor at earliest.
Okay. How should the parent know about this gut issues or any, if the person need any medication or something?
So what I normally suggest, that parents should avoid giving any medication first of all, until I will say, because pain or any gastro related problem can be because of 100 reasons. If you just control the symptoms, it is not going to cure the disease. So as I said, first there are two conditions when they should be alert or they should meet a doctor. Some conditions, what I say, are acute conditions, like my child was well for last 1 year, 2 year, or he was suddenly some problem happens. During that time, if pain is very severe, child is having vomiting, abdomen is distended, child is not able to eat, there is high grade fever, and as I said, child is getting up in the middle of the night and having the symptoms. You have to go to the doctor at that time. Then second group of problems is when problem is not that bad that you need to go to doctor immediately, but it is going on for a long time, like my child is vomiting every week twice, my child after eating some food tells stomach pain, or what I used to see that my child's weight gain was very good but now suddenly it has stopped, last 2 years child is not gaining weight, or you feel my child looks a bit pale, he is not looking that pink that he used to. These all small indications can be related to the gut issue. So definitely any pattern which has changed from normal to abnormal, it can be an indicative of gut related problem. And of course acute problem happens, definitely they go to the doctor, but many of the time these long term problems we keep on missing them and we ignore them.
Okay. And is it a normal thing to get a stomach pain or gut issues or constipation issues or
Yeah.
digestion issues
Yes.
in a child?
So as you have asked the first question, that was very pertinent, it is rising. So definitely it's very common. What we say that out of 100 kids, I will say if you ask any parent, do your child get abdomen pain? Very rarely anyone will say no, my child doesn't get. Some point at a time they get the stomach pain. So this stomach ache is a very common phenomenon, especially this monsoon season when there is so much of rain. This water contamination is very high. In these celebrations and all, children eat a lot of outside food, so they get viral flu, viral gastroenteritis, so many infections. But these pain will be having your, of course, fever, vomiting, loose motions. So these are very common in this particular season. Otherwise, as we have discussed, the increase in junk food, processed food, less fiber diet, sedentary style, all this is leading to the change in gut bacteria. Like normal gut bacteria is the way it is, but when you don't eat healthy food, they keep on changing and they interact with your gastrointestinal system, and it may cause hypersensitivity, more pain, or there are some very serious diseases which are rapidly increasing over the years in children also. So they can all lead to this stomach related issue. Now the second thing you asked about constipation.
Constipation, yeah.
Out of 100 school going kids, we see 30 to 40% are having constipation. So there are so many reasons behind it, but definitely it is rising over the time, and parents often don't even understand that their child is suffering from constipation.
Yeah. And as we see, even though parents try to control the children related to the food
Yeah.
and their habits, they don't listen to the
Yes,
parents.
yes, yeah.
It is unavoidable. So what should they do?
So I will say it's very wrong to preach that let your child don't eat anything outside. This is almost impossible. This is like
They don't listen.
talking in practical thing. Even we don't listen. Often we also keep on go outside and eat food. It's wrong to tell parents when all their friends are eating why they should not eat. So what I say, you should not, a very simple thing I always tell all the parents, don't mix discipline and love. Okay? For showing love, don't give them junk food ki I love you so much so eat junk food. Okay? Give them a healthy, normal, balanced diet. Fix a day. Maybe once in 15 days I will give you myself. What you want, let me give you, so that you wait for that day. Okay, that day I am going to eat. Every day eating junk food should be stopped, and you only decide, discussing with your child, what do you want? I will give you myself. You don't need to worry that you are not going to get it. And you decide which is the hygienic place, you can cook it at home or from where you are going to get it. But it should be periodic, and rest of the days child should eat a healthy food. So probably that may work, although every child is different, but that may work most of the times.
Yeah. And when should a parent should take it as a serious thing like vomitings or diarrhea issues?
Yeah, so these are what you said, vomiting, diarrhea, blood in the motion, all these are the commonest gastrointestinal problems. So any of these cannot be ignored. If a child is vomiting persistently, of course he can't eat anything, and that may lead to dehydration, and you may end up getting him admitted. Same happens with the diarrhea. If too much watery motions are happening, he will become dehydrated and you will end up getting him to the hospital, admitting him. So first thing, if vomiting is happening, most of the parents know what medicine to give. They have their own pediatricians, one dose of medicine they suggest. That I will not be discussing about the medicine, that may give wrong message. So once antiemetic dose they can try if it is getting better or not, because any gastritis may lead to vomiting. It may subside quickly, but if the vomiting is not subsiding, Or a simple trick what I tell parents, give small frequent food. Don't try to give him a lot of food when child is vomiting. Maybe he will be able to tolerate small food. But if these things are not working, of course you may have to go to the doctor. That vomiting has to be controlled. Because if vomiting is not controlled, no medicine will also work. You can't give medicine by mouth.
Yeah.
Now the second thing is our loose motions. So loose motions, when they start, they take time. One common misconception is we should give some medicine that should stop the loose motions immediately. So why loose motions are happening? There is some swelling in the pigu, our small intestine, large intestine, some swelling has happened. Any medicine will not subside it suddenly. What will happen? You give the medicine and stool will not come out. Swelling is still there. And the problem will increase later. Abdominal distension, pain may worsen over the time. That diarrhea will take 3 to 5 days minimum whenever loose motions are starting. So our responsibility is to keep the baby hydrated. So like what we say, especially WHO ORS has to be given to the kids along with the anti-emetic medications or any other medicine if your pediatrician has prescribed. Our main aim to prevent dehydration so that their kidney, heart, other organs don't get damaged because of this diarrhea and vomiting. And more than 90% kids get better with these medications.
Okay.
Now blood in the stool. Again, I'll come to the third part.
Yeah.
So blood in the stool has two issues. It can be because of constipation also or loose motions also. Hard motion coming out, damaging the potty area can cause blood in the motion. Or if a child is having infection, that can also lead to blood in the motions. So if blood in the motion is there, don't use your brain, please go to the doctor and let him decide what child needs.
Okay. Is it always because of the food they take or is there any other reasons?
Yeah, so definitely, as I said, food is a very important thing we have already discussed. Second, infections, as I said, in this monsoon season, even if they are eating healthy food like they are in a daycare, small babies are there, or kids who are in close contact playing or sharing a drinking bottle and all, or they are playing in the ground and they ate some food and they did not wash their hand. So a lot of germs can go from anywhere from in their tummy, from the mouth. So infections are very common, diet is very common. And then there are other reasons which I am avoiding to touch is like a lot of immunity related problems, a lot of genetic problems. So in children, we are more worried about that, but they are rarer. Out of 100 kids, 95% will have infection, diet related problems. But those 5% may have some serious issues where they need long-term treatment. So that is a doctor's responsibility that he finds and discusses with you that is it a possibility or not. And allergies, one thing that I forgot. So these are 4-5 extra things which cause gastrointestinal problems in the children.
Okay. Is it true that food allergies or intolerance is happening more in these days in the kids?
Yeah, so mostly over the time, then I will talk to about a bit of scientific studies.
Okay. From
From India, we don't have any robust scientific studies, but from USA and Western countries, it has been shown that food allergies are rising. So there are 2-3 reasons people give, although strictly we don't know why it is happening because human body, of course, it's changing a bit, but there is not gross change. The change in environmental factors. Like again, the allergens, exposure of allergen to the children. One thing is very interestingly is called hygiene hypothesis. So that means because in recent times we are following too much of hygiene, our body is exposed to less microbes, so our immunity is immature.
Okay.
So they react to things abruptly and that they cause allergy. That is still a hypothesis, but a lot of diseases we see that that's why those diseases never used to happen in India, but it is happening in India because probably our hygiene is improving. I'm not telling we should remain dirty, but along with this, unnecessary use of antibiotics. Like a pregnant woman is given a lot of antibiotics, so in the womb, baby's gut can change. In early infancy, 1 year of life, if a lot of antibiotics are given, that will change bacteria in the gut. These are the factors along with this hygiene hypothesis, what I say. And this processed food and all, what we eat, we don't know what is there, how it is affecting our immunity. And then a lot of things, what happen in early periods, like within 1 year, if child is not eating anything, what we do? One thing where that child is eating, we keep on giving that only for a long time. We don't give a variety of food. So child is not exposed to different kind of antigens, what we say, different kind of stimuli. So his immunity is not getting mature. So these are the reasons that we say that allergies are increasing. But the best part is most of the allergies get better over the time. Some allergies persist for a longer time, like we say milk allergy. More than 90% of the patients get better beyond 5 years of age. Egg allergy improves, but some allergies remain for a longer time. But one thing I will say, it's very easy to say that it is allergy for any symptom, but it can be infection also. So parents have to be very careful before thinking that my child is having allergy. Is this food only causing problem all the time? And they keep on noting it down. That will help your doctor a lot, that okay, with this food only every time symptoms are appearing, rather than randomly, okay, your child is not doing well, he will have allergy, let's stop this. Why to torture a kid because of our poor knowledge?
Yeah.
So better that we clarify what is happening with our kid.
Now, what happens with this food allergies and then intolerances?
How the parents will come to know. So allergies can affect any organ system of the body. Most common is the skin. If redness over the skin, itching over the skin, swelling over the face, swelling over the lips, swelling over the body. Gastrointestinal symptoms are child can have loose motions or blood in the motion, even vomitings, severe pain abdomen, baby can develop all these things. And more severe things what we call for allergy is anaphylactic shock. Child can go into shock and all. So that will be like a very severe kind of allergy what we say. So respiratory symptoms, skin, gastrointestinal system, all these symptoms can appear in a child. When we say intolerance, so we need to understand intolerance is different from allergy. Allergy happens because of the protein. Intolerance can happen because of the any component of the food. They should not be that bad like allergy, so they can have mild GI upset, loose motions and all, but definitely not skin reactions and breathing issues.
So what kind of lifestyle that you would suggest?
Yeah. So one thing that I touched but didn't discuss much was the constipation. So I will start from there, because what happens like so much like I said out of 130% of the kids are having constipation these days, school going kids, and it starts quite early in the life. So the things which parents have to do is it starts from the birth only. Initial 6 months try to give exclusive breastfeeding, so that will save your kid from allergies, from immunity related problems, and it will give a good nutrition to your baby, and of course it will increase mother baby bondage also.
Okay.
Beyond 6 months, don't stop the milk immediately, but start complementary feeding. Solid foods you need to start. From where we start getting wrong, that we don't give the solid foods, child is not eating, so we keep on giving milk. So that decreases their hemoglobin, that will be low in the fiber, so they will start developing constipation now. So they have to give high fiber diet once baby is more solid foods with some fiber beyond 6 months of age, and slowly keep on increasing. Once your baby is 1 to 1.5 years, so 6 months to 1 year you have tried to give all the food along with the milk. 1 to 1.5 year or beyond 1.5 year, you should start toilet training to the baby. That is one more thing is related what we do, nuclear families, no family support and all. Your baby is doing potty in the diaper till 5 years of age. So that is another problem. So every time after eating food, they should sit on the pot for 5 to 10 minutes, or whatever way they are doing the toilet training. It should start beyond 1.5 year of age. So you are giving breast milk, then you are giving solid food, then you are toilet training timely. At the same time, avoiding outside food, junk food, controlling the screen. These are very simple 4-5 things, but very difficult to do. Very easy to preach, but very difficult to do when you have a kid. But you have to do all these simple steps. And of course, don't give antibiotics yourself. First thing, what happened? My baby has loose motions, I gave antibiotic. I went there, he gave antibiotic. Please don't give antibiotics all the time. More than 70-80% of the these problems are viral. So antibiotics will kill bacteria, it will not kill virus. So don't think that antibiotic is kind of amrit you give to your kid and he will become normal.
Okay, what kind of food should be taken by your children?
Yeah, so that's a very important question, I will say. So as I said, 6 months only mother's milk. Try not to add anything. Of course, if any medical condition your doctor will suggest or whatever you feel like, then beyond 6 months we start complementary feeds. Start with one food, slowly start adding varieties with some fiber. What we say, beyond 1 year of age, a child can eat everything that an adult can eat. So after that, what should be the diet? So there should be adequate carbohydrate, protein and fat. Problem of our diet or whatever junk food children eat, there is very low in protein, very high in carbohydrate and fat. So you need to see what will provide protein to my baby, like eggs, paneer, curd, even if they are this chicken and all, they are eating pulses. All these things will give a lot of protein to them. In our culture, like vada, it is made up of dal, so that is a good protein source, I will say. If you are making dosa, make it only from the dal batter and don't add too much of rice in that. That will give higher protein to them. Now third part comes the fiber. So fiber will come from green leafy vegetables, all kind of fruits. So these all should be there. Now what we say, the one important component is probiotics that will increase the good bacteria in our tummy. So again, curd and all the fermented food like idli, dosa, all these things. So I will say typical our Telugu food will give you a lot
South
of
Indian,
nice
yeah.
probiotic food, our South Indian diet. But you have to follow it rather than feeding burger to your kid. Yeah.
So what is the right age? Like up to what age parents should monitor the children about what they are eating, what they're doing, or what kind of lifestyle they're
Till the
following?
time parents are alive, I think. In modern science times, even we need our parental guidance much more than any time in the past, because things are changing too much. Parents' experience is always going to help their kids. But of course, what I say, in adolescent time is very important for them. 2 time periods are very important. Of course, first year child is dependent on you, you have to take all the calls. From 2 to 5 years, they behave very jittery, they are fighting with you, they are not understanding whatever you want to teach them, they are retaliating. That is an important part. 5 to 10, 12 is still when they are start going to school, teachers are telling, they are following. Once the adolescence comes, this 12 to 18, that is again a very difficult phase, because they have all the information on this earth, but they don't know how to use it. So parents has to be very careful in monitoring them, what are they eating, what are they doing, and be very friendly with them so that they share all their confusions with them. Don't keep on preaching your kid, otherwise he will start avoiding. His best mentor, I will say, will become his friend who is very confident he knows anything or not. So parents has to be very friendly and understand them so that they can come up, children can come up with all their confusions regarding diet, physical activity and all. Like if we just remember our adolescence, if my parents are telling, why are you not studying, study, why are you not studying, why are you wasting so much time, you feel like not doing it. So you have to find a way to talk, okay, is there any problem in your studies, what is happening, why are you not eating, rather than just because all the world is doing that with them.
Yeah.
So you need to be their safe zone where they can do anything.
Okay.
So probably you can mentor them better at that time.
Yeah, we often hear about this IBD.
Yes. Yeah.
What is it?
Yeah, so I was talking about a certain segment of diseases I am not touching, which are a bit serious. But very unfortunately, IBD is inflammatory bowel disease. It's a real bad disease, I will say. It is rapidly rising all over the world. When I started my training in pediatric gastroenterology like 15 years back and all, so we used to think that only IBD is a small disease which is not there much in India. Of course, we see the patient, but it is a disease of adults in the Western population. But now we are seeing so much IBD in Indian children, even as small as 6 months and 1 year of kids, and of course it is much more in adolescent kids. So what we say, in adults, out of 100, 3 people are having IBD worldwide. That is what the studies show worldwide. And we are no different. If we say no, we are very hygienic, we are not eating junk, all this is nonsense. A lot now junk is very easily available.
Yeah.
So our lifestyle is changing very fast. But of course, this is not the only reason. A lot of genetic factors and other unknown factors are there. So IBD is a disease where there is a swelling in small and large intestine, chinna pegu and peda pegu. There is inflammation. So there are 2 types. I will not go into too much of scientific details, but they can have blood in the motion for a very long time. So that is one indication. That's a clear-cut indication. You will go to the doctor. But other, what we call a bad variant of IBD, which is Crohn's disease. It's like a great mimicker of anything. Just child is not growing well. He doesn't want to play. His blood is slightly less. He doesn't want to eat food. his height is lowest in his class. Anything can be Crohn's. So if you feel your child is not doing as well as his peers, or big symptoms like too much of stomach pain, any of these things can be Crohn's disease. And then of course there are so many symptoms that I will not get into, but these are the initial indications that parents have to look for. One very simple thing what many of my parents, they tell their stories, like there are two children. One, they feel he is very active eating, so he is growing. Other, he is very dull, he wants to watch TV, he doesn't want to eat, feed, so he is not growing. The thing is other way around, because there is a disease sitting inside his body which is not letting him do anything. So at the end he just want to be dull and watch TV all the time because the disease was there. So some basic blood test can detect it. Once diagnosed, it has to be treated properly.
Right.
And the best part that if you diagnose early, treat early, they can live normal life like any of us. But if you delay it, they will be suffering a lot during their life.
Right.
Yeah.
Thank you so much, doctor, for the
Yeah.
valuable
Thank you.
information.
Yeah. Thanks a lot.
ఇది వాటి ఆయుష్మాన్ భవ. చూస్తూనే ఉండండి 10 TV.